The next muscle in the sequence will be piriformis. And piriformis comes from the S2 to S4 of the sacrum and affects the position of the hip because it attaches to the greater trochanter. There is a thought process that the sciatic nerve goes through it in a certain amount of the population, 1 in 5. And there is a condition called Piriformis Syndrome. But I do think that if a piriformis is tight, then it might be as a result of the problem with the hip joint, or maybe something to go with the lumbosacral or even the sacrum in itself. Now, when we look at the lower limb, many authors will suggest that if a leg is turned out, like if this left leg is turned out, then it might well be piriformis is short and tight. But remember, there are 11 muscles that turn the leg out, and piriformis is only one of those 11. So it might not be the case. And then it might be that instead of the left leg turning out, why can't the right leg be turned in? So you might find, just bear that in mind. So don't automatically think that if a leg is out, then it's piriformis. We can do a little test if we want to from here. We can cross the leg over, and then from here we can just feel for the bind. From this position we can do a simple MET for lengthening of it, and then from this position we can feel the bind and ask a patient to slowly push the leg away, please. So we're activating, because the piriformis is an abductor and an external rotator. So we can stabilize and relax and breathe in, and then we can stabilize the hip and then just take it into further adduction and internal rotation. We can also do the same technique where we push the leg out, please. Patient pushes out. And instead of stabilizing the same side, relax, take a breath, we can just control the opposite side and almost like pull in as you push across. And some people feel more of an effect from that one. My personal favorite will be where I bring the leg up to 90 degrees and we externally rotate. Piriformis is considered to be an external rotator. However, when the hip crosses 60 degrees of flexion, we think of it now as an internal rotator. So what that means is if we externally rotate past 60 degrees, we now lengthen it. And this is what I consider to be true. So place a hand onto the hip, upper arm onto the lower part of the ankle, cradle the knee and slowly turn the leg whilst flexing until you feel a bind. There we go. You can normally sense by the perception from the patient. From this position, take a small breath in, please. Your knee slowly push me. So my patient is pushing into my chest as in extending the hip. 10 seconds later, relax, breathe in. And as I breathe out, if we took into flexion, they don't feel much. If we took into flexion with rotation, we tend to get a bit more lengthening on the piriformis. So it's controlled by my forearm is rotate in whilst I'm flexing. Once you've done it 3 times and you've held for 25 seconds, then come off the position. I do also want to show, if you come another line in front, please. From this position, if we said the left leg lying was turned out, we can bend the knee and we can slowly control the pelvis and we can look to see where the bind is. It's hard to say what's normal because the internal rotation is normally 30-35 degrees. You can see that she has good range of motion here. And then we can quickly compare the same on this side. So range of motion is pretty good for both hip. So that means the length of the piriformis is okay. But imagine on this left side that the movement was say maybe 20 degrees compared to this side. And if you brought both knees together, this one goes a lot further out and this one stays where it is. So we can see that this one is the tighter structure. If that's the case, then what we can do from there is to ask the patient to pull their leg this way, which is external rotation of the hip, for 10 seconds. After 10 seconds, relax please, stabilize the pelvis and breathe in. Then on the out breath, I slowly take into further internal rotation. Hold it for a few seconds at the new bind. Breathe in, please. Watch my fingers. She just taps. I tap, sorry, and then she pulls her leg in. And after the 10 seconds, she relaxes, breathes in, and then I slowly take the leg into further internal rotation. You can also test going the opposite way, and we're looking for about 45 degrees. That is 0 degrees. She does have a resistance to the external rotation. So there's nothing wrong with getting the person to push the leg this way, please. So my patient is internally rotating, which is activating the internal rotators of the adductors and the glute medius and minimus, or the anterior glute med. Relax, please. Breathe in. And as she breathes out, I can slowly take the leg into further external rotation. So yes, we can treat the piriformis from this position, but we can also improve external rotation at the same time. And there you have a few variations of lengthening the piriformis muscle.